Okay. I'll just send it to you as a YouTube clip. Like,
Okay,
I'll just
perfect.
upload it to YouTube, obviously just for you and I, but like,
Yeah, yeah. Awesome. Thank you.
okay, let me just see here. Okay. So when I read this, my big picture, 20,000 foot view is okay, you start with a story about Anna, then you go
Hmm.
into taking care of her as a PCA and like struggle about that. Like, how am I going to do this? How's this going to work? And then you go into shadowing the doctor.
Hmm.
And so my whole thought when I read that was like, okay, well, how are these things connecting? Like, what's the transition between this and this? And then I was thinking, okay, I feel like you needed a follow-up story about Anna. Like, you were so stressed about taking care of her. You started about a story about you were taking care of, then talked about how when you started, you were stressed about taking care of her. And then there was no, like, what happened to Anna? That's like the feeling that I had inside of me. Um, and so I felt like there needed to be a follow-up story about Anna there. That was my initial thought. Okay.
Yeah.
And then it has to be a transition between like what you learned taking care of Anna and how that transitions to you taking care of patients, right? Like some sort of connection between Anna and the next set of patients. Does that make sense?
Hmm.
Um, okay, then I feel like okay, then you talk about working with the doctors that you work with, and then you have this patient who had this terrible experience where they tore their ACL multiple times. And so then I was thinking, okay, what's the point that you're trying to make with this piece, right?
Hmm.
Is it the difficult conversation that your doctor had to have with them, or is it this other piece that you learned that you kind of start to talk about in the next paragraph, which is there are two aspects to healing. One is the actual, what do you call it, repair, and the other is the healing, right? I like that idea, that contrast. So then I was like, okay, that needs to be introduced to me first, right? I love that conversation because that sets you up with like how to think about this, how to approach patients. Like, I
Hmm.
like this story. And actually, then when I started thinking about this more, after I got to this part, I was like, okay, well, let's just keep going. So then you go to the point where you are talking about those two aspects. And I think that's an important idea. Like repair and heal. And that
Hmm.
healing many times, I think it's maybe too much to put it all on the patient. I think maybe part of it as the physician, you have a responsibility for part of that. And that is to motivate, that is to encourage, that is to give them the right tools, right, so that they can then heal. Do you know what I mean?
Yeah, I
And
can
like,
add that in.
you
Hmm.
know what I
Yeah,
mean?
for
So I feel
sure.
like that's part
Yeah.
of it. And so I
Hmm.
think this idea that like, yes, your role is to repair, but the healing part is not is more the mental piece, right? Like
Hmm.
is the motivation piece, is like in the encouragement piece, is the you can do this piece, is like here's the
Hmm.
steps that you have to do. Is the hope piece, like provide them the hope. Here's the prescription of like what you have to do. Your is now your job, and I'm here to support you. Like, right, it's a support role to
Hmm.
get to that point. Does that make
Yeah.
sense?
Gotcha. Hmm. Yeah,
Uh,
I'll reword that.
okay. So and then you apply this to Anna. So then we go back to Anna, which I like think this, I was like, okay, yes, this I like because then it's like, um, because then you're saying, oh, this, I'm learning this from that experience and I'm applying it to this. So that
Yeah,
makes
that's yeah,
sense.
that's what I tried to do is like start with kind of like a challenge I had in my PCA role and kind of maybe I should transition it better so it doesn't seem as abrupt, but my like what I kind of wanted to do was just like introduce a challenge I had with like where I was like actually working hands-on and then see what I learned from like watching shadowing and then apply it to where I was like actually working. I
Mhm.
don't, did it feel better after you got to like the end and you saw that, or do you think I
Yeah.
should still do a better transition?
So here's what I think. Then when I got to the end, I realized, okay, then you start reflecting about
Yeah.
Anna. And then I
Yeah.
was like, okay, I kind of like what you're saying about Anna.
Hmm.
And this idea of like her healing is different and that
Hmm.
healing can be different, right?
Hmm.
And that she's healing in her own way. And part of
Hmm.
that way, I think, then ties back into the first story. Her
Yeah.
healing is to find the joy in life, even
Hmm.
though she can't move, right? And
Hmm.
part of that joy is that first story, right? Like that's
Hmm.
where that comes back
That's
in,
what I tried to
right?
do. Yeah.
And then you have your conclusion. So when I like took a 20,000 foot view of like the ordering of the stories, All of this, all of your stories start or stem from that experience that that doctor said of like healing and repair, right? That's the beginning. Do you see it? Does that make sense? Even though chronologically you might have worked with Anna first and then started out doing this,
Yeah.
the chronological order of how you learned these things and then applied these things started with the doctor here. Does that make sense? Where
Okay.
this conversation here, there are two aspects to medicine.
Yeah.
Sense?
Yeah.
So I think think about telling the story here. Oops. Oh, shoot.
It's okay.
What did I just do? Whoa. Did I just do something? Let me just undo that. Okay. Okay. So I think move this up to the top. Like think about that as being your intro.
Okay.
Think about how that changes the framework and like the idea of what you're writing about when you move that idea to the top, because everything else branches from that, if you can see that. Does that make sense?
Yeah. So do
So
you want me to like start with the big picture learning I had instead of leading up to it with the story then?
I think you can just start with this idea.
Oh, okay.
Does that make sense? There are two, like, what if you just started with the statement? Like, how would you tell the story if you started with there are two aspects of medicine, recovery, repairing and healing. And you can then say, like, this is a question that I posed to the surgeon I was working with. How do you deal with like, how do you, or even you can start with this after like, I asked the surgeon or asked, like, in like a room or after a difficult day or however you want to start that, you can say,
Yeah.
like, how do you deal with this situation? And then she says, or, there are two aspects to recovery. There's repairing and there's healing. And her job is to, in this practice is to repair.
I can say like her primary job and then she needs to support with the
Yes.
recover or yeah,
Or
with the
you could say that could be your own evolution. Maybe she said that, like, and maybe you can keep that. But then like later on you say like I've evolved. My own interpretation is that like there's more than it might be more than that, right? You don't have to say she was wrong or that whatever.
yeah.
You can
Yeah, because could that come off wrong where it's like, oh, she was wrong and I'm better
like
than this doctor?
I took this to heart, but taking care like but you're also kind of saying that with Anna too, like healing doesn't look like healing like during your exercise. Healing
True.
is
Yeah.
different. You have a
Yeah.
different interpretation. Or
Yeah.
that Or you can add that in if you want her to sound like she's saying that because she probably is saying that too. Like when
Yeah. Yeah,
she's
I might just
like,
do that.
you know what I
Yeah. Yeah.
mean? Okay, so then start with that idea. And that like, and then what I want you to do is have a patient, not this patient who is in a really bad place. Pick a different patient. Somebody who came in and you watch them progress and then they like were able to get back under their feet and like how there was those two pieces, right? Like stick with like the this is what you're watching, this is what you're learning. Patient comes in, they weren't able to do this, she does the repair, they do their exercises. Yes, maybe there's some ups and downs, but they are successful and then they have the repair and like that and you fulfilled that like prophecy of like this is what this is supposed to
It
happen.
really
Does that make
happened.
sense?
Yeah. Okay.
And what you learn from that and like what you learn from people coming in and like, having these injuries that are debilitating and like what it means to like, get your get your life back,
Hmm.
essentially. Does that make sense?
Hmm.
Then I think, then you introduce Anna. Then you transition to, meanwhile, while I'm working with Anna, um, let me think. Let me think more. Because then I feel like you, and then you have to transition to Anna.
Yeah.
Um, so that's where here you will transition. Meanwhile, while I'm working with the surgeon, I was also PCing or for this woman named Anna. Like get two sentences to get me to the point where I'm talking about Anna. And you can talk about like and then a couple sentences about like what you wrote up here. Like this whole idea, right? Or mo try moving that idea down below, right? What if
Hmm.
you moved this, my first day of training, like all of these things, and then you say, then you flash back to this thing that you learned, right? Like her for her to heal also means that I need to do my job, right? There's that connection of like there's nothing that can be done for the repair has already been done, right?
Mhm.
But like for her to truly heal and feel as a person, right? That's why if you have that story about like this individual had this thing happen, they tore their ACL, they weren't able to do the things that they love, but then they realized that they could do the things that they love after they, healed. Their like life was given back to them. Then you go to Anna and like, okay, I was worried about taking care of her. There's so much things, but then you think back to what you learned with the surgeon
Gotcha.
at your
Okay.
role is to help her heal, right? And that
Okay.
like, healing for her means like all the things that you said. By doing this better, it helps her have a better experience. By doing this better, it helps her have this better experience. And that way you are now connecting those two experiences very clearly together. Does that make sense?
Yeah.
And then,
Okay.
okay, so then you have, right? And then I think this reflection piece, right, is a different aspect. Like you're tapping into something different about Anna. Like, yes, you can do these things, finding and treating small injuries on her skin so they don't become worse later on. Like, those are important. Those are part of you doing the repair so that she can have the healing and the experience of just having a healthy body. But then there's another piece of healing for her that's important, and that's like the mental healing, right?
Mm-hmm.
And for her, mental healing means freedom. Mental healing means feeling like she has aspects of her old life back, or like that like she can find joy in small things, right? And so then I feel like you bring this story in and you start below, like propped up on a hill and talk about how the story unfolds, right? And you're like, no, I'm not letting you go. And then like and tell like that, like come on, like that's like I want to feel like you're kind of like, oh, okay, no. And she's like, no, I'm serious. Like,
Mm-hmm.
let me go. And like you're rationalizing your brain, like, can I let her go? Like, it's not, like I
Mm-hmm.
want that to piece to unfold a little bit, but like, okay,
Okay.
let's try this. Like, and so I did. Like, you kind of get into that here, right? And so I did, and she started rolling slowly, and then like hits you're like, oh God, okay, this is where we're going, okay. And then I brought this into, right, we talked last time about
Yeah.
passive versus active, and
Yeah.
soon we were in Anna's words instead in
Okay.
Anna's
As
day,
I would
that's
say.
passive
Yeah.
tense, in Anna's words,
Yeah.
flying, right?
Mm-hmm.
And then this idea of flying, right? Where here there was no transition into what flying meant to her and why down here, what you're saying is that like you have to connect that back to healing for her, which you then kind of do here, right?
Okay.
So bring in the story and then talk about healing. And then you can write a conclusion paragraph about what healing means, what repairing means, and like how you want to do both. But like the healing process is so important, and like how, as a physician, you can support the process of healing and make these people feel like they're themselves again. Does that make sense?
Mm-hmm.
I think that's kind of like the reworking. How do you
Okay.
feel about that? I know that's like those are big changes, but how do you feel about that?
Yeah, I definitely see I'm glad that you're telling me how like to rework it in a way that makes sense to someone because it's really hard for me as like someone where I'm like this is my story and to me it's like oh of course it makes sense like I'm starting with this story and everyone's gonna get it but it's helped. Thank you for telling me like how to like rework it so people can like tell what the thread is.
Yeah.
I think that would make a lot more sense. So basically I'm gonna write it down so I don't forget. It's like start with the lesson from the surgeon.
hmm Because do you see that like all of the like when you think about the story in the order that you're trying to tell, you have to think about what's the centerpiece, what's like the center of your onion, essentially. Like what's the piece that you're trying to convey that
Mhm.
and every other story that you tell has to branch off of that piece,
So you
right?
want that to be like this, like the big umbrella that you start with. Okay.
Exactly. So that's where you have to start.
Okay.
Like this
Okay.
theme. The theme is healing versus repair, right?
Gotcha.
Like what both mean. And so you have to give examples of like what both mean, or like a story that shows. That's why the first story showing what both means. You're taking a different route to writing your personal statement than I feel like is what a lot of times do that onion thing that I was talking about. Like this isn't
That's
that
what I
this is
tried to
different.
do. Yeah,
Yeah,
that's what I
this
tried
is
to
going to be
do.
different
Yeah.
because what you
Okay.
have here is a theme of experience. And the reason why it works is because you're talking about patient care the whole time. When it
Hmm.
doesn't work is when you talk about experiences that happened a long time ago, like, and you just stay in the window of like an experience that you had as a child, and you do that for two-thirds of the entire personal statement. And then you get to the end and you're like, talking about applying that to medicine. Like that doesn't work. But if you're working with patients and you're thinking about like, and you have more active experiences, then you can get away with doing it differently, right? And it's an example of doing it differently. You have
Gotcha.
a theme, an idea that you learned, and then everything that you experience that you're talking about in this personal statement is branching off of that theme, right?
Gotcha.
And so you
Okay.
have to be, and so that's why your first story, instead of thinking about the end, your first story is really to exemplify the theme. Like, give me a clear understanding of what that means. Does that
Okay.
make sense?
Yeah. So
And
we start with the lesson and then change the
change the story.
pick a different patient for the story where it's like that ideal progression of devastated coming in. Okay. I'm thinking of there was a lady, she was like in her 70s
Mhm.
and she was really sad because she couldn't like she loves to go on walks with her grandchildren and stuff and she like couldn't really do it and she was really sad and then she got a knee replacement. Should I talk about her, do you think? That's like
Okay,
a
then what
better
happened? Tell me the
what
end.
like she got I never saw her post-op surgery, so I don't know because by the time I like she was done with her surgery, I wasn't able to like see her post-operatively, but I guess like I've seen a lot of patients who have come in post-op for knee surgeries and they were like and they're usually in that same demographic of like older, usually have grandkids and they're really excited that they can like go and spend time with their family again.
So pick somebody who you have seen or
Okay.
meld together a few stories, right?
Yeah. Okay.
In my mind, like, yes, you can have like a lot of people have like a patient where they change their name. But if you're changing a name and making it anonymous, then like it's about your experience. So then
Right.
together experiences.
Other
And
stuff.
so
Okay.
what you have to do is like have it be clear about like, or if there was another patient where you followed like post-op, then like use their example, right? And then
Gotcha.
use them instead and talk about pre-op. Like when they came in, they probably told you like, oh, I've just been looking forward to being with my grandkids. So then you can talk about them pre-op as like their main concern when they came in was this,
Thing
right?
they couldn't do that they love to do.
Yes. And then
Yeah.
post-op, you can talk about like I don't know, like bring it to life. That's what you have to do. Like
Yeah.
picking up my grandkid for the first time or going like teaching my grandkid how to ride their bike. Like there's
Yeah.
something that shows that they couldn't like that they're doing now that they weren't able to do before and bring
Gotcha.
that to life in that way. Um,
Okay.
I think, yeah, pushing them on a swing, walking with them, swimming with them, like something. If you had an experience with somebody that like makes sense, then use that experience.
Okay. And
Shows,
then
right, that
I
they
should
do it.
scrap the story about the guy who tore his ACL 3 times.
Yes, because I feel like it doesn't fit with that idea, right? Like,
Yeah.
yes, that was a hard person, but that fits with a different theme. And that theme is addressing like failure, right? Like, that's a totally different theme. So I feel like that story doesn't exactly fit unless he then came back, stuck with a protocol. You did it again, you stuck with the protocol, he changed the way that he healed, and
Yeah.
then like he had a repair. Like, if that's not the story, then this doesn't fit with like that idea, umbrella idea. Does that make sense?
Yeah, the initial reason why I wanted to do that story was because then I asked her, like, how do you deal with the stress of when things don't go your way? But you're right, I think it doesn't probably like fit as well in there because I was trying to be like, oh, I'm stressed about taking care of Anna and I don't know like how to do that, like if I make mistakes, like how to bounce back from that. And then I tried to like make that same thing there and then
Mhm.
have her say like, "Oh, I just focus on the potential and the privilege I have to make it better for them and the more I lean into that opportunity I have, the less stressed out I get."
Where did
But
you write that?
if I choose to focus on the privilege and opportunity I have to repair injuries as best as possible, or I choose to focus, it's the second to the last sentence in the,
In my
yeah,
app,
yeah,
do that.
that sentence. I choose to focus on the privilege and
Oh,
opportunity.
okay, 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 yeah. Okay, keep that, but the idea is still the same, right? Of like
Yeah.
it still fits better with your theme,
Yeah.
right? And then you are applying that directly to your theme, right?
Yeah. I think what I tried to do was like add too many threads and then it got like confusing and it's hard to fit all of that into like such a short piece of writing.
Yes. I think we
Okay.
talked about this. You might have two threads, but I think we're just good.
Yeah.
And
We'll
I
just
think
stick
the
with
thread
one.
that's coming through after I'm reading the revised version is that the thread is that um this idea between healing and repair and what that looks like, and that like, and you're going to kind of take kind of risks of that. Like it's not the same for everybody. Like yes,
Mhm.
maybe in some ways when you're seeing the same injury over and over, like in the like an ACL, like yes, the repair is the same and like many times the progression of the healing is the same. But like now you're going to apply that to Anna, which is not the same. Right? And that,
Mhm.
like what how does her healing look different? And how does your repairing her look different? Like it's not you're not actually doing things, but you're doing things to help keep her healthy, right? And then
Mhm.
you're also learning that her healing process is different and that like part of her healing process is like a return to her feeling herself, and that happens through like things that you're not doing as repair, like that you're not doing as like you're taking care of her mentally, right? Like by letting go and allowing her to have that experience, you're taking care of her mentally. Does that make sense? So like that idea that there's like that repair also might not always be like a physical thing, like sometimes it is, and with Anna it is, but it's also like repair can also be a mental thing, and
Mhm.
that you're learning about that too, and you're applying that to Anna. So you're applying what you learned in this ACL or in this sports medicine clinic to taking care of somebody who's like a completely different kind of patient, right?
Mhm.
And that you will then at the end apply both like that understanding of healing and repair um to all your patients, right?
Okay, so that's how I should kind of end it off. Because I didn't know really how to end off the statement. Because I like, do you think this whole story would answer the whole why medicine thing about the personal statement well? Or is that kind of something I should hammer in like in the last paragraph I have of my personal statement?
So I don't know if you agree with this, but I mean, tell me what you think. When I think about repair,
Mm-hmm.
maybe you should make this more explicit if you agree. Repair is the physical thing. Repair, the analogy in my mind for a surgeon is do the surgery, do the ACL.
Mm-hmm.
For a doctor who's it's prescribed the right medication.
Mm-hmm.
For, it's the thing that's based on training, like what you've been trained to do as like a
Mm-hmm.
doctor.
Yep.
Right? When I think about healing, the analogies that I think about healing from the perspective of the doctor is the mental piece,
Mm-hmm.
is the motivation, is the
Mm-hmm.
encouragement, is the connecting with what's important to them so that you can then do your repair better or so that they can then do their own repairing better. Does that make sense? So they can then stick to their prescribed medication regiment because they know that like this will help me heal. They understand. Does that make sense? Like those are the analogies that I draw.
100%. Yeah.
So
Yep.
the analogy of like repairing is really like
Physical.
the physical thing, and then the healing is really the mental thing, right? And like sometimes
Right.
they overlap, right? But like you can, in a lot of ways, I think when you think about that process, like there are some analogies, and you can kind of make those analogies explicit, right? Like,
Yeah.
does that make sense? And like Anna, you can do it with both. Like you're helping her heal and you're helping her repair, right? Like you're helping both. And that like you can use that idea as fundamental in any practice. Does that make sense? It doesn't matter if you want to be a surgeon, it doesn't matter if you want to go into general practice or endocrinology. That idea, taking care of people physically and mentally, is medicine.
Mm-hmm.
So
Mm-hmm.
that's where I think it does apply because
Okay.
it is medicine. Does that make sense?
Gotcha. Yeah. Yeah.
But you have to make sure if you want to go with that idea that it's clear that that's what you're saying. Does that make
Yeah.
sense?
Yeah, and I can do that once I like take out that story about the torn ACLs and simplify the other stuff a little bit
And
more.
honestly, you can take this out too. Because even though that's an important piece, I don't think that that fits with the idea of healing and the idea of repair.
Yeah, I think yeah, I'll probably keep the part of the OR with my patient story. So like this will be the OR piece of the patient story, and then instead of like the while or I enjoyed shadowing physicians in a variety of specialties, I'll talk about like introducing the older patient who needed a knee replacement. And then after the OR part, talk about like instead of saying finally patients would be elated post-operation, I would say like I saw this same patient a couple weeks later and he was extremely excited.
So
And then
bring them to life, give them a name,
Yeah.
Start with a conversation that you had, like,
Yeah.
or like the first time I was able to lift my grandkid, or
Yeah, that's what, yeah.
do you know what I mean? Like, start with that, bring it to life, and like what it meant to them. Uh, Wait. Yes. Okay. So yes, condense this down. Use it to tell that story. But remember, like, first is going to be your training in the orthopedics, and then second, you're going to apply that to PCA, right? And so,
Yeah, so I won't say anything about yeah, I'm gonna cut that first part out because instead of that, I'm gonna say while I was shadowing, I was also training to be a personal care attendant. So we're basically like flipping it.
hmm
Okay.
hmm hmm
Okay.
Yep. Okay. I think that'll work. I think that will tell the story much clearer.
Okay, sounds good. And then I have like two things in bold. The first one was I empathized. Well, I guess it's gonna fix it anyway because I'm getting rid of that story with the patient, but I was just worried that in your clinic in February, you were like, try to avoid using buzzwords. And I was like, is empathized a buzzword that's
I don't
gonna
think it is because it shows like what you mean. Like,
okay.
I mean, you could say I connected with if you want to use a different word, right? But like, I think that's a fine word.
Okay. And
Uh,
then do you think this last sentence is a good way to end it, or is that like chuggy and cheesy and weird? The last sentence.
uh,
I'll probably tweak that paragraph anyway, because we're kind of
I don't think it's cheesy. I think it needs to be more focused, is my thing. So, like, with the pure intent of caring for people is too broad. I think you need to connect it back to the root, back to the thread. The thread is repair and healing, right? And so, like, think
both
about
physically
like,
and mentally. I can probably say
yes,
that. Both physically
yes.
and
Like,
mentally.
right? That incorporating or marrying those two ideas, making sure that you're taking care of those two ideas, make sure you're approaching your patient from both aspects, like something like that, that ties back into the root is a much more powerful statement than, right? Because it ties in with what you're saying. And that's what you want to do in a conclusion, is we want to double down on the thread. Oh, in case you missed it, here's my thread again.
Hmm.
Like you almost want to slap them in the face with it because
Yeah,
you want them to know, oh yeah, yeah, yeah. That's why you're telling us. Or, oh yeah, yeah, yeah. That's why. When
like
I
they're
read
reading
Anna,
some. Yeah,
Anna's the place where it's easiest probably to get lost. So you want to make sure that when you're talking about healing of Anna and like the physicalness of Anna, physically moving her, physically positioning her, physically looking for things that can, and why it's important. It's important because this changes her, the way that she lives. Like if I didn't do this, like, she might have an infection that could then lead to days of really, being in pain. You know what I mean? And like that's your response. That's like the physicalness. And then the
yeah.
healingness is making sure that you're providing her with an environment that like where she can thrive, right? And that's your way of healing Anna. Like that's different. That's not going to be the way that you treat everybody, but that's your way of healing Anna. Like that's what you have to do to allow Anna to heal. Does that make sense?
Mm.
That's what you have to do to motivate Anna's healing or to provide space for her healing. And so like with Anna's story, that's going to be the one that's the probably the a little less clear.
Yeah,
Like, your
because
first story is going to be,
situation, like
yeah, like very cut and dry. Like, or like clear and what, like, okay, this person, she does a ACL repair. Okay, I can see how that connects with repair. That makes sense, right? And healing, oh yeah, yeah, they had to do like their PT and they had to, and maybe like that's what you have to like show that progression when you're talking. You do the repair, the doctor comes back in and they motivate the patient. Like, these are all the things that are, this is really important. And then they come back again and they say, like, I was finally able to lift my grandkid. Like, thank you so much. Like the
Mhm.
gratitude that they express for that.
Right.
Right. And so that should be very clear. That should be easy to follow for anybody. And then what you have to do is you're going to say, and I think this is the nuanced part of medicine, is the beautiful part of medicine is like, yes, not everything is exactly the same. Not everything's going to follow this protocol of like da 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 da. The healing sometimes looks different and repair sometimes looks different. And I took that to heart and I applied it to Anna. And this is what it looked like. Right. And then conclusion is that, like, I know that not everything in medicine is going to look the same. It's going to
Mhm.
be different. There's differences, there are nuances, but that, like, I've learned how to pivot and that, like, I'm looking forward to being able to do that. And it's really important that I want to approach all my patients from that perspective of like healing and repair, right? Like the mental, and make that analogy, healing and repair, the mental and the physical, right?
Yeah, I'll like. make that explicit. Maybe at the end I'll make that explicit. Like
Yes, you should.
that. Okay.
Yes.
Okay.
You could even do it in both. Like that idea of like bring in that first idea of healing, like healing is mental and repair is the physical, right? Like
What the
that,
surgeon told me at the beginning.
yes. And
Yeah.
like make that connection clear and then bring it back again. Like make
Yeah.
the connection clear at the end. So that there's no doubt when they're reading it that they're being reminded again.
Yeah. So they can't miss it. Yeah.
So like when I teach a lecture in class, there are many times when I go to a new slide and I would say, okay, remember what we just did? Like, hey,
hmm
remember what we just did? Okay, we're gonna apply that here, right?
hmm
That little reminder back to the previous thing is so helpful to reorient. So that like as you're
Yeah.
doing this and you're reminding, when you're putting in those little phrases, you're reminding them of the thing that they already know is true, right? Like,
Right.
oh yeah, yeah, that's what you mean by repair. Oh yeah, yeah, that's what you
Mhm.
mean by healing, right? Like that's how they're different. Does that make sense?
Especially because these people are probably reading so many of these
Mhm.
where it's like I have to make it as clear as possible because it'll be easy for them to get lost.
Totally.
Yeah.
And the second they get lost, you're only gonna read it once.
Yeah.
You're gonna go
You
back like
don't
four times
want
and
to
be
lose
like, what
them.
is she saying?
Don't
You
want to lose
done.
them. Yeah.
Has to be clear.
And the way I have it laid out now, it's like a little bit of a guessing game, and I need to fix that. Yeah. Okay.
Mhm.
Gotcha. Okay. Awesome. Okay, I have my work cut out for me. I'm really
Yeah.
excited. It's gonna be so much better once I
Good.
fix this.
Yes. Remember, it's a slow evolution. So just slowly evolve with the process. Like you just
hmm
continue evolving and you'll see it evolve. You'll see it change. And at some point, like once you get to that point where you're like, hey, we're almost done, like you'll be like, all right. I feel like that every time I make a new lecture. They're puzzle pieces that aren't fitting together. And then all of a sudden you get two pieces that fit together. You're like, oh, that's the transition, right? Like that's the story. And that's the connection that I need to make that I wasn't seeing before. And now it's clear. So you'll have those moments where it's going to be clearer as you move through it. And so like I guarantee in the next version, you're like, okay, this feels better.
Yeah, perfect.
Okay.
Okay, awesome.
All right,
Thank
I'll upload this to YouTube and I'll send you the link so that you can have it. And I'll just share it with you and I so that
Okay, yeah, that's fine. Yeah, I'm not worried.
anybody would watch it anyway, but like,
Yeah. Okay, awesome.
okay. All right. Good luck. Send
Thank
it
you.
back to me. And if you're like, all right, so if you wanted to meet again, like we could meet again. If you're like, I think I know what I'm doing, like I'm ready to like submit it, then just let me know and then we'll like and then I'll just send you the invoice for that for the
Yeah.
hour
Do you
meeting.
do
So
Venmo? How
yes,
does
it'll be through Venmo.
Okay.
I'll just wait. I'll give you like a week to redo it. And if you're like, nope, I feel really good about this, then we'll go with that. And if you're like, okay, I feel like I want another meeting, then I'll hold off and then I'll send it to you after that.
Okay. Do you want me to send it back to you? So maybe like if you read over it and you're like, oh, this is what we talked about, that's good. Or if you're like, oh, I think we might want to do another meeting.
Yeah,
Or
that
would
can
you
be
rather
totally
have
changed.
me be like, I want another meeting or not?
It could be, I guess it depends what you want. Like if you're like,
Okay.
I'm kinda over this, like I want to just be done, like I get it.
Yeah. Yeah.
But also if you're like, I'm applying a little bit later, I need to have this solid, like I don't know, I would say I would probably suggest one more because I'm like, I just want you to feel really good about where you're at. Now, if you sent it to me and I was like, this looks amazing, great, I'll tell you, we don't need another meeting. Like, I'm not gonna just give you,
Yeah, I know. I
waste
know
your
you're not
time.
gonna
So
do that.
like it's kind of up to you and what you want. But like I'm happy to look at it and be like, I think these are big picture things that I think are worth talking about. Uh,
Okay.
so, but yeah,
Awesome. Okay. I'll work on it and then I'll probably send it back to you and ask for your opinion on how it looks.
okay.
Because I'm really trying to get my application in at the end of this month.
I know. Yeah, I'm sure. I'm sure.
Yeah.
I
Yeah.
totally did that. So like, yeah, send it back to me and then yeah, we'll try to do it. So even if you send it back to me this weekend, we can go from
Okay.
there.
Okay. Perfect.
I
Thank
think
you.
early
And
next.
then for the letter of rec, are you still okay with sending in like the end of next weekish? Like
Did I not
next
send it in yet? Did you send me a link? I have all my letters written. So like,
Yeah, I sent it. Let me make sure I sent it to you. I should have. Let me look.